In this video, you will learn how to get your patients to listen and be compliant with their treatment plans. Hi, my name is Liz. Don't forget to hit the subscribe button and the little like button so that you get notifications of new content. Healthcare is an ever-changing field. In recent years, patients are getting more and more involved in their care plans, even downright refusing some treatments recommended. As part of your patient's medical team, this can be incredibly frustrating, especially when your goal is to help your patient help themselves feel better. Let's take a look at a couple things that you can do to better serve your patients and how to help them be compliant. Help me count down. We're going to look at 3, starting with number 3. First, treat your patients like a human, not a number or someone who is too ignorant to understand medical knowledge. And as a nurse myself, I know that this can be super easy to do. You go to school, you learn all these new medical terms, and before you know it, those terms are just coming out of your mouth. And you actually have to slow yourself down to be able to talk in layman's terms. One experience that I had forever changed the way I view that. So I'm going to tell you that story now. I will never forget sitting in a gown, half naked, vulnerable, after having an especially invasive exam and asking my specialist, and he truly was a specialist, if a certain occurrence was normal or a part of the condition he was treating. His response? Well, he was buried in my medical chart. Statistics don't indicate. I will never forget how I felt. It wasn't too long after that I walked away from this specialist and never looked back. And I'm still thankful that I did to this day. As a healthcare provider, never use the term statistics unless it's to open up a broader conversation to help the patient understand that just because you aren't aware of any issues doesn't mean that their case might be different. If you want patients to respect you and listen, you first have to treat them like a human. All right, and number 2 on our list, admit when you're wrong or something is out of your scope of understanding or experience. This includes natural or alternative treatments. A common issue among medical professionals is to dismiss an alternative treatment simply because they don't understand it. Doctors, nurses, aides, and anyone else who is trained in allopathic medicine is not trained in alternative treatments. Unless they have a special experience or training in those healing methods, they can't give input. One of the other common issues is medical professionals brushing off symptoms as all in a patient's head, simply because they don't understand it. During my last appointment with my primary physician, I was trying to explain the science behind a new natural therapy we'd begun. I couldn't. I tried, but I just couldn't. I just knew it worked. He laughed and said, I really don't need to know the science as long as it works for you. This is how all medical professionals should address alternative therapies. It is also how they should approach symptoms they may not understand. There is so much still unknown about the amazing human body, and no one can truly understand it all or know how to heal it all. Give your patient the benefit of the doubt, and if you are wrong, admit it. This will immediately build trust with your patients. All right, are you guys ready for the number 1 thing that you can do to get your patients to listen? All right, the number 1 way to get your patients to listen to you and comply with your treatment is to first sit down and listen to them. When I decided to go into the field of practice management, I asked a simple question in a couple of the chronic health groups I'm in, with the exception of a single answer. They all said one thing. Really listen to us. Don't brush aside our concerns. Don't tell us statistics don't indicate. We are human. Most of us have lived with these symptoms our whole life, if not every waking moment for years. As a patient, I got really good at hiding symptoms I couldn't make sense of, and therefore knew medical professionals wouldn't be able to either. Thankfully, in 2020, the symptoms peaked, forcing me to dig deep and find out what was going on. I finally had some answers. By the way, the condition I have is said to be rare and only recently discovered by modern medicine in the last couple years. We never truly know what a patient is going through, and we never will if we don't slow down and really listen. Don't forget, Curate Systems is here to help you document it, delegate it, and get it done so you can minimize risk and maximize productivity.